everyone, welcome back to my channel. I'm Dr. Heather Hirsch. I'm a menopause expert, and today on the channel, I want to go over screening guidelines for women. We're going to cover colonoscopies, PAPs, and mammograms, as well as when to get your bone density. So if this is a topic that you want to learn more about, definitely stick around. If you don't know me, I founded the Menopause and Midlife Clinic at the Brigham and Women's Hospital in Boston, Massachusetts, and I now work at MIDI Health, a virtual telemedicine platform, working to create access for women looking to see an expert clinician. Today, I really wanted to cover screening guidelines because due to Kirstie Alley's death from colon cancer, it became aware to me that talking about screening is so important because it has such a big role in early detection and hence early treatment, which can improve your overall prognosis. First, let's start with pap smears. So a pap smear is where the gynecologist or internist or family doctor uses a speculum placed in the vagina and actually takes a sample of the cells of the cervix. Interestingly, cervical cancer is caused by a virus, the HPV virus. Now, most women, for all intents and purposes, this video is directed towards people who have a cervix, but most cervix owners have had some exposure to HPV. In fact, even having one sexual partner increases your chance of the HPV virus prevalence of 50%. Now, HPV itself alone isn't a cause for concern. What is cause for concern is if the virus persists for decades, it can then go on to cause cancer, particularly under stressful or immunocompromised situations. So, keeping that in mind, this is a big reason that screening for cervical cancer, i.e. the pap test, now starts at age 21 and not at your first sexual encounter. And that is because it is the persistence, not just having it, yes or no, it is persistence that is actually what causes any kind of disease state. So your first pap smear will be at age 21, and if your paps are normal, you get them every 3 years. Now, once you hit 30, if you have 3 in a row that are normal, you can go to every 5 years. Your gynecologist will look at the cytology as well as the HPV virus, and that determines at what interval you will get screening. If you have a cytology that looks concerning or a positive HPV, you will have a shorter duration in between your pap smears. So screening starts at age 21, and then how your interval progress goes depends on your own individual results of your screening exams. It's also a good place to remind you that the Gardasil vaccine can be very, very important in reducing the frequency of transmission of the HPV virus. So get that if you haven't, and definitely consider it for your daughters. Next, let's talk about a less controversial topic, which is colon cancer screening. So screening for colon cancer now starts at age 45. And this is important because it used to be age 50. But because colonoscopies and other screening for colon cancers are so good at detecting true cancers, meaning having a lower rate of identifying false positive things that are not cancer and turn out to be a risk to the procedure, they're so good at determining what is precancerous that we now recommend we get them earlier because they really do save lives. Most women, however, find the procedure itself a barrier. You have to drink the Go Lightly, you have to spend a day at home going to the bathroom and emptying out your colon to have a colonoscopy. So there are several other things you can do if this is particularly a barrier. So yearly you can do guaiac stool test, which detects if there is any blood in your stool. A FIT and a FIT DNA test are also other options, but if any of these are abnormal, any of the years that you do them, then you're gonna have to get a colonoscopy. Another option is the virtual colonoscopy, if you will, or a CT scan essentially. You can do this every 5 years, and similar to the yearly annual stool test, if there's anything abnormal, you're gonna need a full-on colonoscopy. If your colonoscopy is normal, you get 10-year intervals between your next colonoscopy screening. What's important to know is that if you have a family history of colon cancer, then you will start your colonoscopy screening earlier. And you will also start earlier if you have any personal medical conditions in the inflammatory bowel category, and you will know probably who you are. Now let's talk the most confusing one of all, which is mammograms. And the reason mammograms are so confusing is there is a lot of different guidelines. You can go with the very aggressive American Cancer Society guidelines, which say to get a mammogram starting at age 40 and going every year. Or you can follow the USPSTF, which is the United States Task Force Preventative Services. I know it's a mouthful and I may have said it wrong. Guidelines, which are a little bit more conservative, which say you can have a shared discussion with your doctor throughout age 40 and recommend starting at age 50 and going every 1 to 2 years. You can see there is a big drastic difference between those two recommendations. What is behind that drastic difference? Well, it has to do with the fact that mammograms are not perfect and they do carry some risks. In fact, so do colonoscopies, so do pap smears, but the risks with mammograms are finding something at a very early stage that may not go on to harm you, that has risks associated with its treatment that you undergo treatment for, worrying in general, having a biopsy that's unnecessary, and on and on. So there are risks with overscreening, particularly with mammograms, because unfortunately, they're not as picture perfect and having a low false positive rate as, say, colonoscopies do. And therein lies the problem of we don't want to harm women by overscreening, and we find that the harms mostly are in the younger population. For the purposes of this video, I don't want to say that one is better than the other, but I do think you should have a discussion with your doctor and follow his or her guidance to help you guys come together to form the right decision on when mammogram screening should start for you. And of course, it's going to depend on your personal history, your family history, and your preferences for tolerating risks to screening. And lastly, let's round this out with screening for osteopenia or osteoporosis, which is a DEXA scan. Guidelines for a DEXA scan say that if you don't have any secondary risk factors, and I'm going to go over that list in a second, then you should start at age 65. The caveat to this is, in my personal experience and in my personal opinion, most women do have something on the risk factor list that means that we should be doing a bone density much earlier than age 65. So what's on this list? There's lots of things. Family history, smoking history, any malabsorptive issue, any inflammatory disease, any early menopause, any thyroid or other endocrinopathies, and any steroid use. The list goes on and on. It's actually quite long. And almost or nearly every woman has some indication for me to allow her to get a bone density earlier. Knowing if you have bone loss, osteopenia being the precursor to the bigger condition or syndrome, osteoporosis, in my opinion, is really helpful for women to make a decision in their midlife to better prevent further bone loss. I have a great video here on bone loss if this is a topic you want more information on. Overall, I want you to walk away knowing that defining screening intervals is actually quite complicated. It's a mixture of public health, risks and benefits, false positives, false negatives, and costs to the healthcare system. So it's not an easy task to come up with screening recommendations. And often you're going to see that one society has a different recommendation than another. Ultimately, you are the CEO of your own body, and this information I hope helps you have a good conversation with your doctor and also merely just puts your own screening trajectory on your map, on your list of things to do to take care of your body. I hope you guys found this video really interesting. Tell me in the comments below, what are some of your barriers to getting screening and what were some of your big takeaways? If you guys love this channel, please consider subscribing to the channel. That tells the algorithm that this channel is really, really important for women in midlife to see. And if this video is helpful, please share it on your socials. I'll see you guys next week for a brand new video. Bye everyone.